It is not easy sometimes to coordinate and organize and to have someone come. I was just speaking with Dr. Hyatt, and I really do hope that this is not our last opportunity to work with Paul International. I'm not going to introduce Dr. Hyatt. I'll let him do that himself. So thank you very much, Dr. Hyatt, for agreeing to come and speak to our parents. He's already done 2 sessions this morning with grades 6, 7, 8, 9, 10, 11, 12. So hopefully he's not too tired. He'll get a nice longer break a bit later. And then a session with some younger students in the afternoon. But it's been a good day so far, and I really appreciate everybody coming. So thank you. Okay, Dr.
Thanks, Mr. Conley. Hi, everyone. Let's try it again. Hi, everyone. All right, so I'm Stephen Claude Hyatt. I am a clinical health psychologist and a traumatologist. I've been in Asia for 17, going on 18 years now. I'm from Jamaica in the Caribbean, but I spent 12 years in Beijing as head of mental health for the then International SOS. I became Rapids Medical. And then now I have my own company called CALM International. It's Cognitive Approach to Life Management, CALM International. And so we're a mental health consultancy. We're registered in Singapore, but also in China, as well as in Malaysia as well. So we provide mental health service, a wide suite and gamut of these services, but we work a lot with international schools. So we work with a lot of international schools, primarily in Beijing, but also we have in the Middle East. We have recently on the African continent as well. I'm here with Maggie Leo, who is our operations manager in Beijing. Yeah? So we do a lot of things, workshops, seminars, we do one-to-one individual sessions, group, couples, we do psychoeducational assessments for students with learning differences to pinpoint exactly what the challenges are and make recommendations to school and to parents in terms of how you can support your kids so that they can in fact reach their potential and be successful. Yeah? Just met one of my kids from a long time ago, Simon, who studied here. And the first time I met him, he was just telling me he was down here. The next time he was here, and now he's here. You know? But it really is refreshing when I come and I see individuals I've worked with, the students, the parents. Francis is here somewhere, yes. It warms my heart. So I'm happy to be here to talk with you all a little bit. We're going to talk about dealing with your teenies, the young ones, your tweens, the in-betweens, and the teens, right? I'm not sure we're going to cover everything, but we're going to try our best. Maggie and Rebecca will be there to help with those who don't speak as much English as I do, or speak better Chinese than I do. Yeah? All right, and so feel free to ask questions throughout. You know, interrupt me, let's have a conversation. It doesn't have to be a monologue, let's make it a dialogue, okay? All right, so we'll be covering challenges with middle school, high school kids. We're going to be looking at the don'ts, the do's as parents. What is it to be a supportive parent? How you deal with resistant children, because we've been seeing that over the years. Some kids that don't want to go to school, and they just don't go to school. And they want to do this and they just don't do it. And parents come to us feeling a little bit helpless and despondent. So how do you deal with that? And signs of a developmental issue, which is going to focus mainly on the tinies. So what are some of the things that you want to look for from early on? Yeah? So, what are the challenges faced by teens and tweens today? And tweens usually from the age of 9, 10, up to 12. Yeah? Yeah? So tweens, what are some of the challenges that you have with your tweens and your teens?
They start having their own mind.
They start having their own mind. How dare they? Anybody else?
They have to knock their door.
You have to knock their door before entering. You have to respect their space.
Yeah.
And them becoming individuals and the need for privacy, but at the same time letting them know this is still my house.
Yeah.
There's still rules. Yeah? How do we balance that? Yeah? So there are many challenges that we face. You know, they face fitting in, peer pressure, self-pressure, which people sometimes don't talk about, because many times it's not your peers pressuring you. It's them pressuring themselves to try and fit in, which then cause a lot of mental health concerns for them as well. Identity. Who am I? A lot of these tweens and teens are dealing with in terms of their spiritual identity. And spiritual is not just about a relationship with a higher being, it's also your relationship with those around you as well. Yeah? Sexual identity. So we're talking about sexuality. Who am I as a sexual being? But they're also dealing with sexual orientation. Who am I attracted to? And sometimes that can become a challenge, especially in this day and age where it's about be and let be. How do you be and let be, but at the same time try to guide your child in a way that will protect them? Values are the challenges that they're faced with. Who am I? What do I stand for? What do I believe in? When should I speak up? Yeah, and for many of these things and teens, it's a struggle because they're being bombarded, they're being hit left, right, and center with all these opinions from social media. I was saying to persons that I didn't know about drugs, like marijuana. As a matter of fact, I didn't know about cocaine until probably university. But marijuana wasn't until I got to high school. The whole thing of sex and feeling pressure to have sex. I'm sure most of us, we didn't have that until later on in life. But now it's in their faces. Yeah, and there is this desire that they have to fit in. And so many of them will have a need to compromise who they are. Yeah, and we have to help them to establish and to fortify these values. Yeah? Don't worry about the baby. It's okay. Babies cry. We're fine. Don't stress yourself. All right. They have to deal with bullying. Yeah, bullying, and then you're bullied because of their race, their ethnicity. Especially those who are biracial. Because where do you fit in? You're either white or black or Asian, or what are you? Yeah, and that becomes difficult for them in terms of their identity. Gender, and that's another big one now, because when many of us were growing up, you had two. Very simple. You're either male or you're female. Yeah? But now, you have many. As a matter of fact, you now have not just male, female, but you have persons who are born in one gender, one biology, but they identify with another. How do you treat with that? How do you treat with the fact that your child was born one way but struggles to identify in another way? These are some of the real challenges that they're faced with, and how do we as parents help to guide them, to navigate them through it? Yeah? SES is social economic status. Some persons are bullied because they don't have as much money or as many resources as others. And again, many of these kids have to deal with this. And the shame that they feel will prevent them from sharing it with parents. So sometimes you have to open the conversation with them in a way that they feel comfortable to share with you. So what are some of the don'ts? Don't expect the worst. I'm tired of hearing people say, the teenage years is just the worst. It's like a monster. You wake up and you don't know who this person is. Sometimes, yes. Yeah? But most of the times, no. For a lot of them, that's not the case. And you don't want to start with that thinking or mentality before your child gets there, because it's going to create stress for you and also for them as well. They are individuals. Let's see what we're working with first before we put a label on it. So don't expect the worst. Yeah? It's not true that they're all going to be rebellious. Some are. Yeah, some are. It's not true that they're all going to sneak out at nights. Some do. Yeah, they're not all going to be doing drugs or whatever. You have to treat your child as an individual, so don't expect the worst. Yeah? Instead of focusing on the negative things that you fear will happen, get to know them. What are their interests? What are the things that they like? What are the things that they don't like? Who are they as individuals? Not what it is that my values are that I'm putting onto them, which it is important for them to know your values as parents, but it's also important for you to help them to determine their emerging values. And a lot of times that's going to come off the values that you have set down for them. And many times children will sort of deviate a little bit. But then they come right back to those base values that you have set for them. And us trying to knock it into their heads and force it into their heads cause them to resist. Just state it, put it there, make sure it's a big part of their lives as they're growing up, leave them to make their choices, guide them, becomes very important. Yeah? Open new paths of communication and understanding. So make sure that you get interested in some of the things that they're interested in. You may not like them, like the video games. You know, I'm not really into video games, but I started playing some video games and exploring some video games because of that. Yeah, so that you can then speak their language. If not, they're not going to want to interact with you when they're going through that phase. Yeah? Okay, don't read too many parenting books. There's some good ones out there, but they don't know your kid. They're very general, and they speak in very general terms. They can't necessarily speak to your individual child. You need to get to know your child. Sometimes experts create more challenges. And I'm saying that as an expert. Right? Sometimes we come and we have this blanket understanding and blanket approach to parenting and to children, and it does not speak to your individual case and your individual child. So read a little bit of the parenting books. It's good to get some insight, to have some awareness. However, you have to treat your child as an individual and get to understand that individual person. So I'm not saying that the books are not good. Some of them are not good. I've read some of them. They're not good. Some of them are good. Yeah? And it's always good to use them as a springboard for conversation. So don't just take what they're saying, as we say, hook, line, and sinker. Take everything. Yeah? Take it as a conversation starter, and then have conversation with other parents. Yeah? With the educators. Because then you have a point of departure to start the conversation. Yeah, but it's not the be-all and end-all, the parenting. Books should be used for perspective, not directive. Which means it shouldn't be telling you what to do, because they don't know your kid. Yeah? It should give you some perspective and understanding about changes in realities and environments and childhood and development and parenting and all of that, but not to take it to tell you what to do with your individual child. You know, we're not raising robots. We're raising human beings, and identity and individuality should be celebrated once it's not dangerous. Yeah? No one should know your child better than you do. And how do you know your child? Listen to them. You know, I get very distressed when I hear parents telling a kid who they are. No, listen to them, even if they don't fully get it. But how are you going to start having a conversation with them if you're not willing to engage them in conversation? So listen to them. Gone are the days about children must be seen and not heard. Very backward thinking. And when you talk with these kids, they have so much to say. You know, I interacted with 6th to 8th graders this morning. We had a wonderful time. You know, just the things that they had to say, the perspectives they had to share. Did I agree with everything? No, did not. But it was fun engaging with them and correcting them in a fun way. That they didn't feel that they were being judged or reprimanded, but they were directed to think in a different way. And that becomes important because they are not adults. Their brains are still forming. They're going to be prone to making mistakes, but you should know your kid better than anyone else. If anyone knows your kid better than you, you are, I'm sorry to say, failing as a parent. Sorry to say that, but I have to say it. You must know your kid better than anyone else. Yeah? Seen and not heard, those days are over. We want to encourage them to speak up and to share who they are, because it is important when they do that with you, because later on when they're out with others who are trying to influence them, they can stand up and say no, because they have practice with being able to stand up and speak up, because parents at home, they're allowed to do that. They're doing it at school. They don't have to worry about school. It's happening at schools. We want to make sure that it's happening at home as well. Don't major on the minor. What does this mean? Anybody? Don't major on the minor.
Don't emphasize something which was not a big deal.
It's not a big deal. Yeah. So she wants to color her hair blue. Let her color her hair blue. It's not a major thing. You know, afterwards she's going to want to change it and put it back to black or brown. You know, that's not going to change the essence of food. That's not a big mountain to die on. And so don't major on the minor. Some of the things that parents will take their kids to see us for, inside I'm thinking, really? You want me to tell you some of the problems some parents are having? You know, your kid is not, that's not a big deal. Yeah? Major on the major. What are some of the majors that we should major on? Huh? Health? Yeah. So what are some of the practices that they have that could be impeding good health? And when we're talking about health, we're not just talking about physical, but also mental and spiritual health. Yeah? Other majors. Education. That's a major. You know, going to school. Getting there on time. Doing your homework. I mean, these are the major things. And even though we want to emphasize these things, we don't want to get into fights or battles with them. If they're not doing something, there's a reason. Let's try to understand the reason first before we seek to correct the behavior. Many times we try to correct the behavior, we don't understand the reason, the child doesn't feel heard, he or she decides to push back because I'm not heard. Yeah? So pick your battles. Do not make an issue of everything. Just make an issue of some things, the major things. Yeah? Some lessons you need to leave to your child to learn. Like some parents keep emphasizing, you know, getting early to school, and they make a big deal and a battle and wake up in the mornings. I'm like, no. Let them wake up late and let them go to school late. And let them deal with the consequence of getting to school late. Because the school has things in place to deal with that. And after a while, I mean, Michael was telling me earlier about having them come at 7:30. You know, that's their punishment. Not after school, but 7:30, coming early in the morning. I used to have a problem with time when I was in school. I would get to school late, not because I didn't leave home early, but because of everything that happened between home and school. We took the public bus. Yeah? And my supervisor, your supervisor, grade 9, the school started at 7:30 a.m. She said, I need you in my office at 7:15 every morning to tell me good morning. And you better believe that 7:15 every morning I was there to tell her good morning. And that changed the trajectory of my life. You can ask anyone who knows me. I'm never on time for anything. I'm always early. Always early. Because that changed. I learned that lesson because of school. Yeah? So let them learn certain lessons on their own. But there are other lessons that the consequences are too much. We have to put our foot down as parents and to say, no, even if they're upset, even if they're, I hate you, that's fine. They hate you in that moment. They don't really hate you. They just hate that you're forcing them to do that particular thing. It's okay. It's not about trying to get your child to, I love you all the time. Because if your child is always happy with you, then you're doing something wrong. Your child should not always be happy with you. Yeah, because children don't think like adults. The things that we want them to focus on, they don't want to focus on those things. Yeah? And so some lessons we want to make sure that we intervene. And I usually say pregnancy is too big a lesson. Yeah? Even if abortion is legalized, the toll that takes on the person, mentally and physically, that's too big a lesson. Sexually transmitted infections, too big a lesson. I don't want my child to learn that lesson, on their own. Or other such things, landing up in prison, too big a lesson. So some things we want to intervene, other things, we need to let them learn the lesson. Yeah? When your child becomes a preteen or teen, your role is to offer guidance and comfort. Especially if you've already laid the foundation. So laying of the foundation is important from they're very young. The do's and the don'ts, what's expected, Yeah? What it is that you can be flexible on, the things that you're not flexible on. Yeah? These are deal breakers. You can't break this. Once you do that, children will assimilate these things. And when they get to teen years, of course there are going to be things trying to pull them away. It happened with us as well. Your job is to guide them, to remind them of the lessons that they learned. Remind them of the values that they have, to comfort them when certain things happen. Yeah? Your job is not to be a police officer. There are many parents now who the relationship between them and their kids is very contentious because they're just being a police officer. No, traffic ticket for you, you know? Whereas the child just wants some understanding. And so many times I will say to them, you focus on the parenting. Let me work through those other things with the children. Because they're not going to hate me. They're not going to hate me. I'm not their parents. And even if they say they hate you as their parents, they don't. Yeah? But it's easier for them to listen to someone else, even the very exact thing that you say to them. If someone else says it, they're liable to go, oh, okay. Yeah? And so that's fine, do that. But make sure that you're laying the foundation first. Nobody else should lay the foundation. You should do that as parents. Don't be naive, so be aware. Be aware of what's happening. Alcohol, drugs. You know, I have parents who would say to me, oh, my child would never. And I know that the child is doing it because the child told me. And of course, I just play ignorant, right? Oh, my child would never. Oh, my child doesn't have access to those things. They don't. Don't be naive. You know? Again, we're not saying that they're all doing all these things, but be aware of what's happening around you. Be aware of what's happening in the environment, and make sure that you're having a conversation with your kids about these things. Don't come down hard on it. You know, people who do drugs are stupid. No, because if they're doing it, they're not going to come to you because you're going to think they're stupid. So why are they going to come to you to reinforce that? You know, but people who do drugs sometimes are misled. Sometimes they have serious issues happening, they feel misunderstood, they just need someone to give them guidance. If you're using language like that, the child is more likely to come and share with you if something is happening, because the fear of being judged is not there anymore. Yeah? So don't be naive to these things. If you suspect any of these, take action. And action could be coming to school to talk with the counselor or the teacher that your child is close to, because sometimes that person can get through to your child quicker than you can. It's not bad parenting. It's just reality. And the best parents are those who recognize that they have a village that's helping them with their child. And that's okay to tap into other members of the village to help. That doesn't make you a bad parent, it makes you a smart parent and a good parent. Yeah? Some parents made the mistake of seeing it as a phase. So if the child is experimenting with drugs or drinking too much, and a lot more, it's alcohol. They're drinking a lot of alcohol, they're sneaking it in. We had a case in one of the international schools where the child was just always drinking water. You know, water bottle with vodka. Which is odorless. It just looks like water. Until they realized that the children, there was more than one of them, they were getting a little bit happy during the school day. And then when they checked, they realized they were drinking vodka at school, not water. Yeah? So we don't want to be naive. For some people, it is a phase that they're going through. For other kids, it could be a lifestyle that they're developing. And we want to be aware of that so that we are guarding against it. Yeah? Look for sudden changes in their behavior, the parents, academic performance, and friends. These are some indicators. If they're changing the way that they're dressing suddenly, something is possibly or potentially happening. Not always, but possibly happening. If their behavior is changing, and sometimes behavioral change indicates other things. Many times kids are sent to us because of behavioral issues, but it turns out that they're depressed. Because teenagers tend to act out their anxiety and their depression. So if they're feeling anxious, if they're feeling depressed, they become more argumentative. They become more truant. Probably skipping out on classes or places that they should be, and then we see it as a behavioral issue. It's not, it's a cry for help. Yeah, and so it's very important that when we see these changes, that we go, oh, okay, potential red flag, we need to investigate. If we see changes in their friendships, their grades slipping, again, if we see these things, we don't want to become alarmists. We don't want to go on the attack. What's going on? Why are your grades down? We want to go in a much more understanding way. What's happening? Is there something you need to talk about? See your grades on. Grades, they're not everything. They are important, but we just want to understand what's happening with you. So that child feels that it's not a combative situation that they're going to. It makes them more likely to open up and to share with you. Don't be extreme. One way or the other. I've seen parents who, when they sense this loss of control, they just crack down on everything. Tight curfew. Not having any sleepovers, no this, no that, be home at this time. And then that just causes things to become even worse. Or some parents are just too laid back. This more laissez-faire approach. Laid back approach, the child can do whatever they want. That's also not good. You want to have an approach that's much more in the middle, because what I've found is that kids tend to reject their parents when they become too harsh in their approach, or kids sometimes feel that parents don't care. I remember when my younger sister, she's also a clinical psychologist. She also works in CAM International. People think we're husband and wife. It's my younger sister. But we grew up in a home where our parents are both teachers. They're both principals. I attended a school once where my dad was the principal and my mom was the vice principal. Fun times, right? But the point is, I remember we would only go to school, school events, church events, home. That was it. And I remember once a friend of ours was spending the weekend with us, and we went to a church event in the night, and we did other things with friends, and we're going home late. And the three of us going home, my sister, myself, this friend, and my sister and I were complaining, that mom is going to be there just waiting for us to get in. And all of this drama, and we're complaining. And my friend turned to us and he said, "Your mom doesn't sleep until you get home?" And we're like, "No, she's always up." And he's like, "Wow, I wish my mom would wake up for me." He says, when I get home, if I get home after a particular time, the door is locked. I have to sleep under wherever. And we go, wow. That's extreme. It made him feel unloved. Then we recognized, he loves us. Thank God for her. So you don't want to be extreme. You want to find a way that is much more in the middle. Find that balance. Restriction and freedom. So what are the restrictions that you want to put in place? What are the rules that you want to put in place? But what are the ways that you can give them this sense of agency, this sense of self, that they're able to make certain decisions, especially when they get to a particular age? You want to be able to figure that out depending on the environment that you're in, because one of the things about being in an environment like this, very international environment, is that you have different cultures and customs and rules. So in one part of the world, it's different from another part of the world, but you're all right here. And then the kids are like, "What's wrong with you?" Because John's mom allows them to get home late. You're so boring. But this is not John's mom's home. This is my home. But at the same time, how do I find that balance between restrictions, rules, a little freedom as well? And again, you have to deal with that with the individual child. There's no one blanket solution. There's no one size fits all. What's peculiar about your child, and how do we? So when I meet with parents, it's important for me to get to understand that child in order for me to then be able to give them guidance. Parents will come to me and say, so-and-so is happening, and how should I? I'm like, I don't know. I have no clue. I haven't met your child. I have to meet your child first, get a sense of who he or she is, in order for us to then determine how we move forward. Yeah? So rules need to be established, but this should be done in collaboration, especially if the child is at a particular age. It's not a dictatorship. You don't want to feel as if you're the Gestapo. You're Hitler. Rules, and the child is like, okay, concentration camp. No, we don't want to do that. We want the child to be able to feel that they're part of this discussion, especially when they get to a certain age. So when they start getting to middle school, you might say, oh, that's early. But yeah, things are changing. Things are changing. Again, as I said before, the things that we knew when we got to high school or university, they're knowing them now from from age 8. They're knowing these things. Yeah? And so we want to, incorporate them into some rules. It doesn't mean that they get the final say. But it works better when they feel that they're part of the process.
Dr. Hyatt, can I have a question?
So when I talk to the parents, a lot of times my suggestion is like, yes, you include your children in setting up rules in the home. But another question about, challenge back is like, the parents say, yes, we set up the rules together, but it's really hard for the kids to follow the rules that they agree upon. So what's your suggestion?
And sometimes I would say that happens because the child feels that he or she has to go along with a particular rule, that's set, because they feel that this is what the parent is expecting of them, and so they'll agree to it, even though that's not really what's happening on the inside. Sometimes because they are intimidated. Yeah, and so in order for it to be really a reflection of what the child is wanting and what the parent is wanting and thinking, you have to say to the child, just be honest, be open, I'm not going to be upset, just tell me what you're thinking. I mean, I have a case right now with a particular child I'm working with the parents, and the parents came with a set of rules. And the child negotiated with me, and then with the negotiated rules, I took it to the parents, and then we were able to agree on a particular formula. And it works because the child recognizes that she couldn't get all what she wanted, but the parents also had to recognize that they can't get all what they want. There had to be a compromise. So what is it that you're willing to let go of? What is it that you're willing to give on? It makes it easier that way. But it doesn't necessarily work for everyone. Again, it's not on all sides. One size that fits all. We have to know what we're dealing with the individual child.
A compromise.
A compromise.
Constantly compromise.
Yeah, again, choose your battles. Choose your battles. Because if you choose to give them this, because it's not that important, I can give them that. This that is very important. No, I'm standing for this. You're getting home at 9:30. Yeah? No discussions. I don't care that Mary's getting home at 11:30. You're getting home at 9:30 because I gave you that. I didn't want to give you that, even though it was okay. They can have it. You don't need to know that. I didn't want to give you that, but I gave it to you because I'm compromising. Yeah? Give and take. Get to that middle ground. You set the rules in conjunction with your child. The final word is yours. You are the parent. I just cannot understand why parents argue with kids. You're not equals. You don't need them. You love them. They need you for food, shelter, phone, video games, travel overseas, pretty clothes, shoes, whatever. They need you for all these things. You don't need them. You love them. So when you say this is the rule and they're arguing with themselves. Especially after we have already compromised and agreed on things, don't they want to come and argue and push back? I'm gone. I'm not having an argument with you. We've already set the rules. Yeah? The problem is when parents now start arguing with the kids. Why? And shouting over each other, you lose your authority that way. You don't need to do that. You remain calm. We already talked about this. Yeah? If you want to have a renegotiation, we can have that renegotiation, but it doesn't work this way. You can't now change the rules just like that. Yeah? So you have to be the one to realize that I have the final word as a parent, but I know it's not a dictatorship. I'm taking into account the needs and the wants of my child as well. Do's, give teens some leeway. You know, again, choose your battles. There are some things I don't like, but it's not such a big deal. I will allow them to have it. Again, the hair color. Yeah, I will allow them to have it. Give them some leeway. Give them a chance to establish their own identity based on the values that you taught them. You know, they have this saying in Christianity, and I'm sure it's in other religions as well. Train up a child in the way he should go, and when he's old, he will not depart from it. And really what it's saying is that the values that you've instilled, those values are still going to be there. You know, it's hilarious to me when I hear certain persons who are like criminals, and they're talking about God. I pray to God. You know, the values are still there. They may not be following it, but the values are still there. Yeah? So we want to instill those values in them, but the way in which we ensure that they follow those values later on in life is that we are re-emphasizing it throughout their lives. We're not just instilling it, but we're reminding them about these values. But we have to give them a chance to figure out who they are. Because when they go to college, you're not going to be there. And that's when we see a lot of kids fall down. Because all throughout their lives, they've been doing what their parents want them to do, and they've not gotten a chance to figure themselves out. So now they go to college, and all of these things are coming. These not so good things, but they're not able to stand up because they weren't given the opportunity to do that earlier. So they fold. Because that's what they were taught, indirectly by parents. You give in to what I'm saying, instead of trying to establish who they are. Those who get a chance to establish themselves, when they go off on their own, they're able to say, no, that's not me. I'm not into that. Yeah? If you notice them stepping out of bounds with friends, etc., intervene with love, with understanding, trying to understand. Don't be judgmental. You know, sometimes the words that we say to our kids scar them for life. You're worthless. You're an embarrassment. No, we don't say these things to our kids. You know, I'm so ashamed of you, and the way that we say it with just vitriol, the child just feels deflated. Yeah? There are ways that we can correct their behavior, but still allow them to know that we love them. You know, what you did was horrible. I don't like that. The child I grew and loved should not be thinking that way. You know, I will always love you, no matter what happens, but not the way you behave. That's unacceptable. In a calm voice. You know, I usually say to persons, it's important to be angry. But we misconstrue what anger is. We misunderstand what anger is. When I ask people what's anger, they tell me about violence and aggression. Shouting, yelling, cursing, swearing. And I say, no, that's not anger. Those are potential byproducts of anger. Those are behaviors. What's anger? Me saying to you, Steve, I don't like when you speak to me that way, as you did earlier. It makes me uncomfortable. Please don't speak to me like that. That's anger. It's expressing a dissatisfaction that you have about something. Yeah? I don't really like when you speak to my child that way. It affects their sense of self, and that bothers me. That's anger. Yeah? Shouting and cursing and swearing. No, violence and aggression. And it's the same thing with our kids. We can be angry with them to say, no, don't do that, in a very caring voice. It doesn't have to be a harsh voice, in a very loving voice. When you act that way, and I know it's difficult, it's easier said than done, especially when you're really wrong. You know, it's difficult to say, but you have to remember. She's like, I don't know.
Try it today.
And that's all I can ask of you, to try. To try. Yeah? But but expressing it. If you find yourself getting so worked up, take a break, give yourself a time out. You know, I'm stepping away from this conversation, we'll have the conversation in a little while. Step outside. Instead of saying things that would injure your child's sense of self. Because that's not what we want. I oftentimes say kids grow up with issues because they have parents who love them. Isn't that sad? You have parents who love you and they just want the best for you. They want you to be successful, to be healthy, to be happy. But then we put our anxieties on our kids. The fears that we have. And it's those fears that make us aggressive when we're talking to them because we want to protect them from that thing. But then that injures them. Yeah? And it doesn't get the message across because all they see and experience is the anger, that rage that comes from the anger. But if we practice finding a subtle, nice way to say it to them, but then stick to your word. Because when I say this is not going to happen, it's not going to happen. I don't have to yell to make it not happen. It's just not going to happen. Yeah? And it doesn't matter how much you argue. Invite your friends to dinner. How much time do I have left? 30 minutes. Okay, yeah. Invite your friends to dinner, their friends to dinner, especially the ones you don't like. Because when you say to them, don't talk to that person, that's when they want to talk to them.
Yeah.
You know? So that one that you don't really like, invite that person and that child over. Interact with them. You get to influence that child as well in terms of values. Respect. The values that you think they should have. You know, some of these kids, it's not that they're bad kids, it's that they're trying to discover who they are. And sometimes you can give them the opportunity to do that. You know, as I said, you know, I grew up with teachers and our house was never empty. We always had someone there living with us who was disadvantaged or coming for dinner who whatever. And in that way, you get to instill some of your values on them because they probably don't have the opportunity to have these values as well. If the kids recognize that you're making an effort to connect, it makes a big difference. They're going to make an effort to also connect and be a part of your life. If they think you will just judge and disagree with their choices, they're going to sneak around. They're going to hide and do it. You think they're not doing it, they're doing it. They're smart. I mean, really smart. I don't know what it is, but kids these past 15 years are just so smart. The things that they think about at the early age, I'm like, what? Yeah, so they're smart. They're figuring things out. You want them on your side. You don't want them on the other side. Okay, so parents should be in agreement on rules and consequences. One of the biggest things is when you have parents differing and the kids divide and conquer. So they know when to go to daddy for what and when to go to mommy for what. They work the system. So you have to make sure that as parents, you are in one agreement. Yeah? Even if you don't fully agree on certain things, you have to learn how to compromise as parents. Because you want to have that one voice going out to the kids instead of two separate voices. So parents should agree firstly, and then you agree on the ground rules with the child, but parents should be talking about this and stand together. If your partner does something you disagree with, don't correct them in the presence of the child. Because it undermines their authority. Yeah, you know, take them aside, not even let the child see that you're doing it. It could be later on, talk about it, agree, and then come back and present to the child. And many times I see, sad to say, fathers do this. They undermine the authority of their wives in the presence of their kids. They may not mean to do it. They think that they're doing the right thing as the man. You know, but most of the time the child is at home with mom, not with dad. Yes, we have exceptions to the rules. We do have some cases where the mom is the one out most of the time and dad is there. But predominantly speaking, mothers tend to be the primary caregivers. Yeah, and you don't want to take away that authority from her. Because then what happens when you are not there? Conflict. Yeah? Discuss curfews and checking in. And checking in is very important. Yeah? If your child has a curfew, let's say 11 p.m., we agree that you're checking in every 30 minutes. Because I need to know what's going on with you. And checking in could just mean you send me a message. Or you take a picture and send to me. You're checking in. If you don't agree to this, you're not going out. Simple. Again, you are the authority. But you're compromising with them. You're allowing them to go out and to have this curfew, but they must be check-in. So you know what's going on with them. Curfew should be based on the city you're living in, the age of the child, and the behavior of the child. Again, it's no one size fits all. Some kids are just much more responsible than others. You want to take that into account as well. Yeah? You want to take into account the city you're in. How safe is it? You know, some cities are safe, others are not. Other cities seem to be safe, but they're not. So you need to be mindful of that also. Yeah? They should be given a curfew that they agree to and that parents are comfortable with. So again, it's a compromise. If you leave it to the child, they're going to want a longer curfew. 2 a.m. And you probably want to say 10 p.m. or 9:30. Okay, what's the compromise? Come at 11 or 11:30. They have a compromise. And oftentimes the compromise, it works. As I said, checking in is crucial. You need to know where they are at all times. Yeah? And the nature of the check-in should be based on the teen and the level of trust that you have. There are some teens that check-in needs to be a video call. Because if they think they're smart, you're smarter. I need a video call. I need to see where you're at. Because I don't trust you yet. When I trust you, it can just be a text message. But you need to know, based on your kid and the level of trust that they have incurred. Yeah? Sometimes teens feel that they're invincible. They can handle anything. They can deal with anything. This is not going to touch me. Yeah? So you have to talk to them about the risks. Drugs. We had a case a few years ago with one of the international schools where this young lady was out. She was in grade 10 and she was out, and some of the other girls around her saw this guy spike her drink. She didn't see it. They saw it. Yeah, and it's a good thing they were there and saw it, because then they took action. Kudos to them. Yeah? She was oblivious to it. So we need to make them aware of these things. If you're going out, keep your drink with you at all times. Do not let anyone order a drink for you. Yeah? Don't leave your drink to go somewhere. Don't take a drink that's already open. Yeah? It sounds paranoid, but it's not. It's only paranoia when it's not likely to happen and you're worried about it. If it's likely to happen, it's reality. It's not paranoia. And these things do happen. Yeah? You want to make them aware of rape culture. Because rape culture is real. Yeah? And rape culture happens not just with girls, but with boys as well. You know, it may be scary for them, but if they're wanting to go out and have this type of reality, they have to know, and especially those who are going to go to study in the US or Europe. There is a rape culture on campuses that people have to be aware of. If they're not aware of it, you're not helping them to protect themselves. Because you don't discuss it doesn't mean it doesn't exist. It just means that they're naive because you're helping them to be naive. You want to empower your child, make them aware of these realities. You want to talk to them about sex. Yeah? One of my first jobs out of graduate school, I worked as a school counselor at an all-boys high school in Jamaica. Right? And in Jamaica, the high school, we follow the British system. So high school starts at grade 7 and it goes up to grade 13. Grade 11 is where they'll do their external exams. If they do very well, they do something like pre-university, grades 12 and 13. Yeah? And I had many guys who would come and tell me that their girlfriend is pregnant, or the word the girlfriend is pregnant. The youngest one was 12. 12. And this was many, many, many years ago. Yeah? His word his girlfriend is pregnant. Now, why is he worried his girlfriend is pregnant? Clearly he's having sex and it was unprotected. Or he wouldn't be worried. Yeah? So we want to talk with them about these things so that they know the worst that could happen. And if they know the worst that could happen, how can they protect themselves from the worst? We're not doing them any service. As a matter of fact, we're doing them a disservice when we don't talk with them about these things, because they're happening. Yeah? Give them a game plan. So if they're going out, give them a game plan what to do if there is a potentially unsafe situation. What can they do to protect themselves? Discuss it with them. Come up with situational realities that you can brainstorm together and they can have a plan. But above all, let them know that they can always call you. No matter what happens, they can call you. Your child must never feel that the worst thing to do is to call mom or dad, because they're going to be angry with me, or they're going to be upset with me. No, anger and upset is left for later. The first thing is love and consolation, making sure they're safe and protected. Later on, we can talk with them about the risky behavior or the misstep that they made. Yeah? But your child must always feel that they can come to you and they can call you no matter what. So, this is an example. If they feel that the only option they have is to get into a car with a drunk driver, they know I can call mom or dad, they'll come and pick me up. And they're not going to be angry with me. It's better for them to do that than go in the car with a drunk driver. Yeah? Your child must always know that mom and dad, they're safe harbors for me. Even if they disagree with what I do, they're still loving me and want to protect me and want to make sure I'm safe. Yes, they're going to reprimand me later. And they know I'm going to get it later, but in this moment, they're going to be protecting me. Yeah? Respect their need for privacy. That came up later. Have to knock the door. Yeah, it's your house, but it's their room. Right? So there is a need for privacy. We all have a need for privacy. They need to know that they have their own space that you'll respect, but they must understand that if you suspect something, you have the right to investigate. So I've had many cases where kids had drugs in their rooms and other paraphernalia. The parents were clueless until they had an instinct to search and found things that were happening under their roof. So the kids must know that if you suspect something, you have a right to check, but you're going to do that in a particular way. You're going to investigate with respect. You're going to be sensitive. You don't want to be too intrusive because you may be wrong. And what if you're wrong? That affects your credibility as a parent. They'll use it against you next time. Remember when you barged in my room and embarrassed me in front of my friend and nothing happened? And you want to do it again? And then it caused you to second guess yourself. Right? You want to do it in a respectful way, but it must be done. You're not firstly your kid's friend. You're firstly your kid's parent. So you must make sure that you're doing things to protect them. Let them know the door is open for dialogue and discussion. You'll not force them to share. But again, once the foundation is shared, is laid, and the child feels comfortable, they will come and talk with you. I know parents and kids, they have really good relationships, really open communication and dialogue, even when that child is like 17, 18, 19, because they already laid that foundation from pretty early. The child doesn't feel like he or she's going to be judged by the parent, and so they're open to come in and having a conversation. So be a role model to your kids. They oftentimes tell me their parents are hypocrites. They say one thing, but they do something else. Or they'll say something when they're in the presence of the teacher, but at home it's very different. And you can't have your child's respect if they think you're a hypocrite. Yeah? So you want to make sure that you're being a role model. You stand for the things that you believe in. Kids respect you when you stand on principle. Even if they don't like it, because it gets in the way of their plans, they respect it, especially if they realize that you're being fair, you're being reasonable. Yeah? It's not just about being tough. You're also able to compromise, to major not on the minor, but the major, give them leeways as well. They're able to respect you. So you want to ask yourself, am I being a role model for my child with the things I'm saying, how I'm behaving? Yeah? Actions speak louder than words, we oftentimes say. We have a saying in Jamaica, kind of similar everywhere else, what you are is so loud I can't hear what you're saying. So what you are, how you're behaving is so loud, it's so in my face, I can't really hear the lie that they're telling about who you are. Actions speak louder than words. And so the best way for you to show your child that you are being non-critical, non-judgmental, is for you to be living that with them. Yeah? Now, I want to talk a little bit about some of the signs of possible developmental issues in elementary kids. Some of the things to be aware of. And we talk about developmental disorders, and there are two that we've been seeing a lot of in schools in the past decade. Yeah? ADHD, attention deficit hyperactivity disorder, and ASD, autism spectrum disorder. Yeah? And persons will say there's an increase in diagnosing these, and sometimes we'll say, yeah, that increases because more kids are being tested. Yeah? At the same time though, you have misdiagnosis, where children are being misdiagnosed, but they don't really have that. It's something else that's happening. Sometimes a boy is just being a boy and being very energetic. That doesn't mean that he has ADHD. I usually say one symptom alone does not a diagnosis make. You have to have a diagnostic criteria and a group of symptoms in a particular duration or period of time for us to begin to say, hey, it's possible that this is what's happening. Let's investigate it. Yeah? So, some signs: inattention, hyperactivity, impulsivity, organicity, mood dysregulation. So in attention, we're talking about a group of symptoms. If you find that your child is finding it very difficult to focus and attend on something they do not like for an extended period of time, it's something to take note of, right? Even kids with ADHD can focus for an extended period of time on things they like. So I oftentimes hear parents say, but he can play video games for 3 hours if I let him. He has no ADHD. You know? And we say, yeah, because he likes video games. Or a girl can read for 3 hours because she enjoys reading. Things that they enjoy doing, they can focus on. Things that they don't enjoy, for the rest of us, we can still focus on them. For someone with ADHD, they can't. So if you're seeing this with a child, so a lack of sustained attention, yeah, we have what we call selective attention. So they're focusing on something, but something else is trying to get their attention, they can select to focus on this. If that is an issue where the child then goes to the next thing, and something else, oh, a butterfly, a bird, and they forget that they're supposed to be doing their homework, that's probably a problem with selective attention, yeah? Or divided attention. They can't do more than one thing at the same time. Hyperactivity, a lot of energy, but we see this in boys all the time. They're just boys. Again, are there other symptoms? But hyperactivity comes in other forms. It could be agitation. So someone always has to do something with their hands. So you have kids, they're always fidgeting, playing with something. They can't sit still, they're scratching, they're this, they're that. That's also potentially hyperactivity. That's a big, as well as it could be anxiety. Yeah? Which is important because sometimes we talk about a comorbid presentation or a differential. A comorbid is when you have two things at the same time. The differential is when you have one thing, it looks like one thing, but it's actually something else. And sometimes when kids are diagnosed with ADHD, it's an anxiety that they have about an issue or a class or whatever. It's not ADHD. Impulsivity, doing things without thinking about consequences. So they keep getting into trouble, or speaking out of turn, or interrupting people when they're talking. These are impulsive behaviors. The child is not being disrespectful or rude, they can't control it. Yeah? If we're seeing this happen, you tell them all the time, when I'm talking to whoever, don't cut me, just wait. And they can't wait. Mommy, 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 daddy, oh, can't you see I'm talking? And then 2 minutes later they come again, and then you get frustrated. No, the child is probably just impulsive. They can't help it. We have to find out what's wrong so we can help to support. Organicity is problems with organizational skills. So if your child is constantly losing things, can't remember where they left things, if their bag is constantly messy, room, but yes, that's a part of it. But if we're dealing with teens, they probably have messy rooms a lot. But if their rooms are messy, they keep forgetting things, they can't do things in a methodical way, that's also hyperactivity as well. Mood dysregulation, changes in their moods. Their mood change easily. 1 minute they're happy, the next minute they're angry. Yeah? In infants, sometimes we know something is happening when they are difficult to soothe. So, they're constantly fussy. It's not that they're hungry. It's not that they're tired. Yeah? It's not that they need to change. It's not that something is happening, but they're just difficult to soothe. They're constantly crying, etc., etc. That's sometimes a sign that something could be happening. Yeah? If they prefer to play alone, they don't enjoy the company of other kids. They get excited just playing by themselves. Yeah? Difficulty making friends if they don't seem to understand social cues and rules. Again, one in isolation doesn't mean anything. Two, no. But if we see a group of these symptoms together, then it's time to investigate. And the earlier, the better. If you have a diagnosis, I know persons love to talk about don't pathologize the child, right? Which I have a challenge with, because if someone has a physical diagnosis, we're not pathologizing them. We're diagnosing them so they can get treated. Yeah? Well, it's the same if we have a developmental issue. We're not pathologizing the child. If there is an issue, we want to know there's an issue so we can intervene to give that child the opportunity to be successful. And many of these kids are successful. I have many kids that I've worked with who have gone on to do well in university and have their careers now. Now they're married with their families because they had intervention early. As opposed to those who didn't because their parents were either in denial or not willing to hear what's happening. So if something is there, it's there. We're not putting it on the child. We want to find out if it's there so we can then do things. And there are many things that we can do. You go to your medical doctor, and even now, COVID was in the US, and you have COVID, they go, okay, these are the things. But we need to know if it's COVID or it's the flu. Because the course of treatment is different. Well, it's the same. If your child, if they have ADHD or some other learning difference, okay, this is what it is. Okay, these are the things you need to do to help that child. If you know that, you're helping your child to be successful. You're setting up your child for success. If you see hyposensitivity or hypersensitivity, and hyposensitivity is when the child lacks sensitivity to things, to touch. Yeah? Or if there's loud noise, they don't respond to the loud noise. Yeah? Hypersensitivity is the opposite. It's when noise just bothers them. Noise, sounds, visual field, they're overstimulated. Textures, they can't wear certain clothing. Or if there's a tag on the clothing, it makes them uncomfortable. That's hypersensitivity, and it sometimes speaks to other things that are happening at the developmental level with the child. Yeah? So what should you do as parents? You want to first speak with the child's school counselor about your concerns. To then have the counselor help you to explore options. Your child should then be seen by a clinical psychologist, an educational psychologist, or an occupational therapist, not a general medical doctor or a psychiatrist. Why? Because in order for this child to be properly diagnosed, they need to have a psychoeducational assessment. A medical doctor is not trained to do that. A psychiatrist is not trained to do that. The psychiatrist is trained to treat someone with mental illness with medication. A psychologist is trained to treat someone with mental illness with psychotherapy and other approaches, and they work well together. Yeah? But if we're talking about a proper diagnosis, then we need to ensure that we're actually doing the right thing, sending them to the right person. A clinical psychologist is trained to do psychoeducational assessment. An educational psychologist is trained to do that as well. An occupational therapist is trained to do some of those, especially with the developmental reality. So you want to make sure that your child is getting the right help. Usually we do a comprehensive education assessment. Why? Because if someone says, I think your child has ADHD, go check them for ADHD. If we just do a test for ADHD and it shows that there are symptoms of ADHD, it will say, okay, the child has ADHD. But it could be that those symptoms are as a result of anxiety, or as a result of some other thing that's at play. When we do a comprehensive assessment, we're ruling out possibilities or confirming possibilities. So some tests will cancel out each other, which is important. We had a case once where the child came with a diagnosis of ADHD, but the child also had severe anxiety, and the ADHD medication made the anxiety worse. And it's when we did a comprehensive assessment, yes, the child did have ADHD, but she also had anxiety and some learning differences. Once we're able to figure that out and have the right treatment in place, then she did well. Yeah? So a comprehensive is important to help us to understand exactly what's happening and how we can treat with it. So what is it to be a supportive parent? There are 5 minutes. 1, beyond the obvious, so beyond clothing, shelter, food, and education, who can tell me? What is it to be a supportive parent? Listen to your child, yeah? Understanding your child and their concerns and their fears and their worries. What else? Role model. So being a good role model for your child. You should be your child's first role model. You won't be the only, but you should be the first. Yeah? Hold your child accountable. That's being a good parent. If they do something wrong, hold them accountable. They have to learn the lessons. Many times I see children, parents they'll come to school and they're confronting the teacher on something that their child did that's wrong. And they know that their child is wrong. And their child knows that he or she is wrong. And they're going, That child is knowing that later on I can do worse and get away with it. And it's going to be on you as parents. Hold them accountable. If they do right, celebrate it with them. If they do wrong, hold them accountable. Choose an appropriate pathway if you disagree with the school or a teacher. One of the things that you have in common with the school is what? They want your child to be successful. You want your child to be successful. You're on the same page. Right? And so you are not conflicting with each other. You shouldn't be. You should try and find a pathway to move forward. And usually the child is at the center. I've worked with many kids many times, and they'll say something to me and then something to the parents. Until all 3 of us get together. Then we find the truth. What's happening? Yeah? So don't make assumptions until you're able to meet with the school. Social media is not the best mediator. So I know many parents take to social media and blast the school. I don't know if it's happening here, but I know of it happening in 2 schools in Beijing, where it was a fight on social media, and then the world had to know that there's a disagreement between administration and the school. That's horrible. The kids are seeing that. It impacts on them as well. Yeah? Be present. Be there for your kids. That's the best thing you can do. I mean, I know that we're all busy, we're all trying to give them the best life that we possibly can, but we shouldn't let devices parent our kids. We shouldn't let the IE parent our kids. They should be support systems, but we should be present. We should make the time to be there. Because you know what? They didn't ask to be here. They didn't. We chose for them to be here, or if it's accident, it's our actions that caused them to be here, but they didn't ask to be here. They shouldn't be punished. Yeah? Stand up for your child when they're right. When they're right, stand up for them. They must know that you're going to have their back. Yeah? Hold them accountable when they're not. If not, again, you're going to be sending the wrong message to them. They can get away with bad stuff. Do not hand over your parental role to anyone. Not the school, not the IE, not a relative or a friend. You are the parent. Yes?
So I understand the point that we should always stand up for our child when they're right. But I want to know that when that happens in front of our spouse, how can we handle that situation, or how can we balance that?
That's a very good question. So if your child is right and your spouse is wrong, how do you balance that? You take the spouse away and have a conversation first.
But I'm just being conscious of the consequence that she is getting the belief that I'm not standing up for her.
Yeah.
When she's right.
So you go and talk with the spouse first. Then later on you go and have a conversation with your daughter. How old is your child?
She's 7.5.
She's 7.5. So she has to start learning from now that mommy and daddy are a team. We're not teaming up against you, we're teaming together for you. Yeah, and we want to make sure that we're making the right decision, and sometimes we're going to have discussions to make sure that we're making the right decisions. And if we make mistakes and we're wrong, we're going to admit that to you, but we're going to have to talk about it first. You're laying that foundation for her, because sometimes you will have the disagreement. It shouldn't be in front of her. Then you go talk to your spouse and help your spouse to understand why you think he's wrong and the child is right. Sort that out between both of you, then you're able to have a conversation. If it is that your spouse is not able to see that, then you need to get someone to help him to be able to see that. But you don't want to undermine his authority in front of her. And you don't want her to feel that she's always wrong. Good question. Okay, our time is up. We have to stop. But what I'm going to do is I'm going to have a PDF of this presentation available, and so that it can be given to you guys, and I'll make sure that you have my email address. If you need to reach out to me, you can reach out to me. Okay? Thank you. I wish we had more time, but thank you.
Thank you again, Dr. Hyatt. We need to get Dr. Hyatt some lunch. So, he has another session.
And the bus will leave in 10 minutes if you want to take the bus home.
Thank you. All right. Thank you.